Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. As many of us try to navigate the healthcare system, we try to find ways that we can actually heal, perhaps the more natural way. But we get very confused about the mixed messages that we hear from friends, relatives, doctors, and even the system itself as it tries to broadcast itself through mass media, magazines, television. There are even shows that doctors try to feature natural remedies. And sometimes when we discover that, well, they just don't do what they say they're going to do, we become very confused about what works and what doesn't. Joining us here on the Beyond 50 radio program today is author of the book, A Doctor's Guide to Alternative Medicine. Our guest has taught more than 2 decades what alternative and complementary therapies are out there to doctors just like himself. He is a family physician, and he also works out of a private practice and an associate professor in the Department of Family and Community Medicine at the University of Toronto. I'd like to welcome to the Beyond 50 radio program today our guest, Dr. Mel Borens. Dr. Borens, thank you for joining us here on the program today.
Daniel, thank you so much for having me.
Now, this is really an interesting field because a lot of times people will try to pursue this, and then a lot of times they might get met with resistance, especially when it comes to mainstream medicine. Tell us why this is also so difficult, I guess.
Well, you know, we in the medical profession tend to be a very conservative profession. We tend to want to give treatments that there is some scientific evidence for, meaning randomly assigned double-blind control trials that have been done comparing the treatment to a placebo. And so doctors tend to want to, give patients the kind of treatment that they were taught in medical school. A lot of alternative treatments have a bad reputation. Sometimes doctors have had bad experiences where a patient's tried something, it's caused some problem, they've not wanted to follow the doctor's opinion and tried something and had a very bad outcome. And so doctors are fairly skeptical in general about alternatives, mainly because they're not familiar with them, they haven't seen the research, they weren't taught about it in medical school, and they're just not comfortable with that whole area. There's so much misinformation and so much stuff on the internet that just may or may not be true that it creates a sense of doubt and mistrust.
I find it pretty fascinating, and I'm sure you do too, that now the internet in some ways has replaced television as being that reliable source of information.
That's true.
The internet.
That's true. The internet has become a source of information about everything, and a lot of it isn't helpful. Some of it can actually be, a problem. And I think that's essentially why I wrote the book, A Doctor's Guide to Alternative Medicine, What Works, What Doesn't, and Why, because, there's so much misinformation out there.
Now, just to give the listeners an idea about your Doctor's Guide to Alternative Medicine, your layout is that you talk about a particular modality, then you lay out, pretty much its history, what it's all about, its scientific testing, and then pretty much your conclusions about that particular thing. And I think that's an easy way for people to understand what this book has to offer. And I think more importantly, it's also an interesting guide because people really should be doing their homework when it comes to these things, shouldn't they?
Well, that's right. I think there is this feeling that because something's natural, that it potentially can't have any dangers or problems, where in fact everything we do has a consequence. There's sometimes things that we do that might be interacting with medications that the doctor may have given us, and sometimes there is a potential harm even from taking a particular herb or natural health product. That it is very important that people do their homework, and it's the buyer beware approach. You can't just put something in your body without really knowing the full story about it.
Mm-hmm. Now, let's go ahead and start with a couple of these so people get a feel for how the book is laid out. Maybe, as they listen, they can begin to realize, well, maybe I should look into this a little more than I have. We'll start with herbal remedies. There's a big one that's out there that people tend to go running after, and the more is better syndrome seems to crop up.
Well, herbs are natural in that they're, grown naturally, and they've been used for thousands of years, and they're relatively safe because the traditions in traditional societies, people know what herbs to use for different conditions. Traditional healers will prescribe a group of herbs to be taken together for a particular problem, each one balancing each other. And yet, every herb, has a potential risk, and there is a lot of confusion about herbs. Sometimes, one of the real problems with herbs is what's in it, actually in it, and is there anything else that shouldn't be in it? For example, there are reports of people buying a herb, for example, in India or in Hong Kong or off the internet, and get into trouble, get into the emergency of a hospital, get admitted to a hospital, and it's found out that, wow, there was lead in that herbal product, or that there were extra drugs and stuff added to that herb that wasn't on the label, or the fact is that the herb that they thought they were taking wasn't being taken. So I do have a whole chapter on the whole concern about the problems with herbs. And, one of the things is to buy, if you're going to buy a herb, I would make sure it's, produced in North America, that it's labeled in a sense that it's been proven that's what in it is in it, and it's been given by someone who's reliable, who's had experience in herbal medicine, and that they know what they're doing.
So now, in the conclusion that you draw in the book, what do you actually have to say about herbs that people should really know then? I mean, I know that you've pretty much summed it up there, but kind of give us a conclusion on that.
Well, conclusion is that herbs are like medications. They have potential benefits, but yet they have potential dangers. They can interact with modern drugs. Get your advice from a licensed health professional who's really been trained in herbal remedies. Make sure that the remedies are clearly labeled. Buy from a reputable source. And, one of the big things, Daniel, is I find that sometimes, and the research is saying that sometimes people don't tell their physician what they're actually taking. And, there's a whole kinds of reasons for that. But the big trouble is, let's say you're going to have surgery and you're on a particular herb, and that herb could interact with the anesthetic that the anesthetist is giving you. And it's really important to, tell your physician exactly what you're doing.
Now, the next one is one that is actually really beginning to catch on over, especially the last 20 years, to be accepted into mainstream medicine as even part of a healing process, and that is of acupuncture. Let's talk about that one.
Well, as you say, acupuncture has been around for thousands of years. In China, it's still, very much part of traditional Chinese medicine, and people go to an acupuncturist or go to a medical doctor, either or. Many medical doctors do practice acupuncture. I think it's a very safe approach. The main concern is to make sure that the person who's doing the acupuncture uses disposable needles, or at least sterilizes the needles in a very specific way, because there have been reports of people getting acupuncture and then developing HIV disease or hepatitis or other infections because the needles weren't properly sterilized. But we find that acupuncture is more accepted even in the medical profession. Some hospitals and pain clinics are using acupuncture as a modality. In my book, I talk about sham science. In other words, they've compared acupuncture where they put the needles in the right spots, and sham acupuncture where they put the needles in, or they might not be putting them in the acupuncture points, or they may not even be piercing the body, and seeing what is the research that's showing acupuncture works. Now, there's a lot of research in China that's hard to decipher, to trust, but there is research that shows that acupuncture is very good, for example, for osteoarthritis of the knee. It's very good for nausea and vomiting. Nausea and vomiting in people, let's say, who are getting chemotherapy, for example, or post-surgery, or even nausea and vomiting of pregnancy, or nausea and vomiting from seasickness, wearing C-bands, which are things that go around the wrist and are pressing on the P6, the pericardium 6 acupuncture point, there's some evidence that acupuncture can be really helpful for nausea and vomiting. There's evidence, too, Daniel, that acupuncture is good for tennis elbow, it's good for neck pain, and it's been studied and shown that it's helpful for headaches. Now, I guess the big challenge is what acupuncturist do you go to? Certainly there are MD acupuncturists who've been trained. There are people who, have been trained in China with traditional Chinese medicine degrees, and people taking other courses in acupuncture, but it's kind of buyer beware again. Who do you go to? How do you get referred to an acupuncturist? Maybe your family doctor, your primary care physician would know of an acupuncturist that they use or that they trust. And acupuncture is great because even though it might be slow and not immediate effect, but it's pretty safe and can be used for all kinds of different conditions.
Now, one that I was really interested in, and it's funny because I was having a discussion with somebody on this, and they seemed to think this was totally quack medicine, but in looking into it, it seems to make sense if you approach it, again, like with a lot of these things that you feature in the book. Do your homework, find reputable sources, and, pretty much there it is. But that of homeopathy, what I was surprised is that you were talking about in the book how a dog was treated with homeopathic approach because of a scratching problem, and I was kind of surprised. I thought, why not homeopathy for a dog? Why not for animals? But talk about that one, for instance. What is it?
Well, homeopathy is probably the most controversial of all the approaches in terms of physicians, because physicians really can't understand how something that's very, very dilute can have any kind of positive effect. And so of all the approaches, physicians and many other people are very skeptical about homeopathy. I was first introduced to homeopathy when I first became interested in alternatives. We formed a sort of an organization, and we had speakers come in every month talking about different kinds of approaches. And I was aware homeopathy is popular in other countries, but I'd never really heard about it. And my wife, interestingly, had planter's warts on her feet, and got treated with a dermatologist not very successfully, and was very painful treatment. And the homeopath, said, well, I'll treat your wife. And lo and behold, after his remedies, after a few weeks, her warts completely disappeared. Now, many people say, well, yeah, warts, it's psychosomatic, it's not, it's placebo, it doesn't really work, but it certainly got my interest, in homeopathy. And as you may or may not know, the royal family supports homeopathy, and the royal family in England have always gone to homeopaths. And in England, homeopathic medicine is covered by the national health system. And in England, most of the homeopathy is practiced by physicians. And homeopathy is very popular also in France and Germany and South America and other countries that have embraced it. It was basically discovered a couple of hundred years ago in Germany by a physician who found that by giving a dilute form of a substance, something that causes symptoms, by giving the dilute substance, it relieves the symptoms that it causes. And this is what kind of, makes people very skeptical, because how could something that's very, very dilute actually have an impact? And yet, there are some studies, what I would call randomly assigned, double-blind controlled trials that have been done and reported in the medical literature, in the British Medical Journal, in the Journal of Pediatrics, and in other reputable journals that have shown that, in fact, homeopathy has some benefit and can be useful. Once again, a lot depends on the practitioner, how they've been trained, and the success comparatively. There are also trials, randomly assigned double-blind controlled trials, that have shown that it's not that useful as well. There's trials done for headaches and for migraines and for asthma, and trials done on arnica, probably the most popular homeopathic remedy, that show that it doesn't work at all. But I felt, to put it into my book, because there was these positive trials with using homeopathy for allergic or for runny noses, allergies, for diarrhea, for other kinds of conditions, I thought that there was some trials that showed that homeopathy was doing better than placebo. So I have a chapter in the book about homeopathy.
Now, it's again, you were saying that it's a very controversial thing, but yet it seems to be pretty mainstream over in England. And you have to wonder sometimes, since, something that big, such as the royal family seems to embrace it, that there must be some validity about how effective it is, but it really depends on how it's applied and what it's applied for, it sounds like.
Well, that's true. Also the Swiss government did a large study and document to decide if homeopathy should be covered by the government-sponsored health insurance. And in fact, after the research and the report, it has been decided to continue to support homeopathy by the health insurance. Similarly, in Britain, they commission, looking at the research in homeopathy to really see, is there any evidence for it? And also, apparently, the document that was presented to the Parliament in Britain also showed enough evidence that they continued to support it by the government health system, and it is very popular in France and in Germany. I attended a conference once in France on homeopathy, and there was 1,000 MDs from around the world who were using homeopathy. It was very impressive to me to see, the interest worldwide. And even though it's very controversial and a lot of people have difficulty with it, I still wanted to put it into my book to clarify my thoughts on it. One of the things that's very controversial, Daniel, and I have to mention it, that you mentioned this, is using homeopathy for vaccines. In other words, to immunize kids against measles or chickenpox or polio or something like that. I have to say that as a physician, I'm very much in favor of vaccines. I think it's one of the most important preventative health, things that we've come up with in modern medicine. And to think that a homeopathic remedy will protect you against polio or diphtheria or something serious like that, I think that is really just not true. And I'm fairly strong about asking people to get vaccines for all these conditions and not to immunize their kids with homeopathy as a way of preventing things like chickenpox or measles or tetanus or anything like that.
Now, one of the things we've been talking about at least a few times here on the program is the connection with digestive disorders and, of course, overall health. I mean, think about it. What you put into your body, that's where it all starts. That's where it all breaks down, and the body uses, for instance, the energy and the nutrition that it takes in, including the air that we breathe, all of it. And you talk quite extensively about probiotics for your gut. Is that something that's kind of quackery, or is that something people should really be paying attention to?
Well, again, what's interesting for me is seeing the movement of a lot of these things that were considered quackery or not believed. Now modern physicians are starting to use it. So it's very interesting to me to see. I attended an infectious disease conference a month or two ago, and the infectious disease people were talking about using probiotics to prevent C. difficile infections and using it for travel prevention when you go to countries like Mexico or Indonesia or India, and you might get a gastroenteritis or a very bad diarrhea and bowel infection. These people were saying, take a probiotic every day as a way of changing the bowel flora or the germs that are living in your bowel to, prevent you from having a serious infection when you're traveling. So what used to be kind of called quackery, physicians are now starting to support it and actually prescribe it. I think the challenge is, Daniel, is that there's so many different probiotics, and so many people say, well, I take yogurt. Well, in fact, the research has been done on certain probiotics. Not all yogurt has active bacteria, and not all yogurt has the kind of bacteria that might be helpful. But I think the most common thing that probiotics might be useful for is with antibiotic-associated diarrhea. And you're quite right that our gut has germs and bacteria, and those bacteria are so important to our health. And when the bacteria get disrupted, and bad bacteria that are living in the gut start to take over, then people get symptoms, and not only in their gut, but you're right, it can affect their whole body. So some physicians and some research is saying that even up to 20% of people can get diarrhea when you take an antibiotic. And so their research is, I think, impressive enough for me to suggest that if you're taking an antibiotic, it might be useful to take a probiotic along with the antibiotic and to take that probiotic afterwards. That C. difficile, Clostridium difficile, is a very serious infection that's becoming more common in hospitals and in elderly people who've taken antibiotics that causes a real disruption in the gut and a very serious infection that could be life-threatening. So I've even heard physicians suggesting to take a probiotic if you've ever had C. difficile or Clostridium difficile, or to take it in somebody who might be prone to or at risk for developing that very serious infection. There's also some randomly assigned double-blind control trials, and just to clarify, Daniel, so your listeners may not know what I'm talking about, is if you're going to test something out, let's say a probiotic, you want to take a certain number of people. The more people in the study, the better. So if you've got 1,000 people and you give 500 people a probiotic and you give 500 people a sugar pill or a placebo, the people who are in the study are randomly assigned, meaning not all the sick people are in one group and all the healthy people are in the other group, or not all the smokers are in one group and all the non-smokers are in the other group, but they're controlled. In other words, there's the same number of, let's say, smokers in each group and the same number of elderly people in each group, and they're randomly assigned. It means they're just assigned randomly to what they get, the placebo or the real thing. And then the people who are giving the placebo or the probiotic, they don't know which is the real thing. And the people who are getting the treatment, they don't know if they're getting a placebo or the probiotic. And the people who are assessing the symptoms at the end and assessing how the people are doing, they don't know who got the real thing or the fake thing. And then you follow the people over a period of weeks or months or sometimes years, and you see, is this treatment better than a sugar pill or a placebo? And that's what we in medicine, kind of base our decision on what's scientific evidence for it. So there is evidence that even for the treatment of diarrhea in children, by taking a probiotic, it can sometimes shorten the severity, the length of time of the diarrhea and the severity of the diarrhea. So whereas probiotics, I would say 10 years ago, really was considered quackery, I think now there's enough research that many physicians are starting to consider it, even in the treatment of irritable bowel, which is such a common problem these days of, bloating and gas and abdominal pain, and sometimes diarrhea and sometimes constipation and nausea. There are some studies that have shown that taking a probiotic might improve some of the symptoms. But as I said to you earlier, it's difficult to know which probiotic to trust, and that takes a certain, skill and faith in the practitioner who's advising you to take it.
So you wouldn't really recommend that somebody take a probiotic daily then, or at least look into why you're doing something like that?
No, I'm okay with the daily probiotic. Okay. I have no difficulty with it. Some people shouldn't take a probiotic. If you are, let's say, have immunocompromised or have HIV disease, or you have a central venous catheter or an artificial heart valve, there's a worry that taking the germs could actually be, a problem or can cause trouble. So not everyone, just like everything, it may not be appropriate for everyone, and that's why, I always think it's best to consult your family physician or your primary health care doctor to find out, which probiotics are reliable and which ones are good, and maybe it's not appropriate for you to take it.
I have to wonder, Dr. Borens, is, as the Internet has certainly become a strong foothold for where people gain a majority of their information, from that information they base quite a bit of their decisions, that as a doctor, it must sometimes drive you nuts with people coming in to see you saying, I read on the Internet that it's this. What are your thoughts on that? You just probably sometimes don't want to hear it, do you?
Well, again, that's one of the reasons I wrote the Doctor's Guide to Alternative Medicine, because of this whole experience that physicians have. What's difficult is if someone comes in and they've got 15 pages that they just downloaded from the Internet about something that, is supposed to be scientific, but as soon as you look at it, it's not scientific at all. It hasn't been reported in a reputable journal. It wasn't done with enough people to make it significant. It could be anecdotal, meaning some person could have gotten well with it, and I'm not knocking that everything we do has to be scientifically proven, because there are lots of things we do that has no science to it. But yeah, I think physicians find it difficult. We all go to medical school. We have experience treating people for years and years, and because someone on the Internet says something might be useful, I think the most common one we see is weight loss regimens or weight loss natural health products, or there's no proof that any of them work. If they did work, we would be using it. It's very difficult to lose weight. It's really challenging. But there's a lot of misinformation and a lot of, anecdotal. Anecdotal means it can help one person, it can help a couple of people, but doesn't mean that there's a science to it. And yeah, it is challenging for us as physicians to try to, first of all, answer some of the questions, because some of the times, even if I know a lot about these things, there's sometimes patients will bring in something that I have no knowledge of whatsoever. And then sometimes I'll go on the Internet with them and say, okay, well, let's look at this. Is there any proof to it? And I'll look at, PubMed, which is PubMed is a place, pub.med, that has scientific trials that have been peer-reviewed, meaning physicians have looked them over and have accepted them as being factual and acceptable. And I'll look, for, let's say, in the National Institute of Health or other reliable websites, let's say Harvard website or some of the other ones that are relatively reputable, and see, is there any evidence about this herb or natural health product? And then, even more importantly, is there any chance there's a danger to it? For example, I have a patient who comes in and they have, when we do blood tests, they've got their kidney function is down, or they have liver abnormalities. And I ask them, okay, what are you taking that could be causing damage to your kidney? Or what are you taking that could be aggravating your liver? And they're not on any medication. And then a number of times I've inquired more deeply and found that, in fact, they're on a herbal medication. And even looking at that herb up, looking it on the Internet or looking in my books, that herb isn't known to cause kidney damage. But when the person stops the herb, their kidney tests improve. When the person stops the herb, their hepatitis or their inflammatory liver problem has gotten better. So this is the kind of thing that makes it really difficult, that, where do you get your information? And it is tough for physicians to have to answer questions about things that, the person might have read on the internet, it can be frustrating, and you're quite right about that.
Well, your book certainly takes the frustration into an area where people can start doing their homework, and I figure probably the best advice we could give today is that a person individually has control over what they put into their body. So, just put in good food, good nutrition, breathe in good air, drink good water, sort of a thing, and get exercise. Those are the basic things you can do. But when it starts to get to an area that perhaps you're not well-versed or well-trained in, don't immediately run to the Internet and pull information that seems credible because it's on the Internet and start running with it. Really have a partnership with your doctor and ask questions and say, I'm kind of looking in this direction. What are your thoughts on that? And how can we kind of work together to see if perhaps this might be a good thing for me? But today, and this day and age, they'll take that information and they'll almost sometimes use it against their doctors, like, well, how come you're not prescribing, or how come you're not recommending I do this? I'm going to go find somebody else. And it's sort of like jumping into the lake real fast before you even know how to swim. And that's what I really like about what you've got here, is that, it kind of allows people an opportunity to really look into the matters a little bit deeper and hopefully realize, your doctor really is on your side, but you also ultimately get to choose what direction you want to take when it comes to the advice that you're getting.
Well, I think what you've just said, Daniel, is really true, that the intention of the book is even, give it as a gift to your physician, a doctor's guide to alternative medicine. Give it as a gift. Present your questions in a way that's not threatening, not, as you say, not putting the physician down, not attacking the physician for lack of knowledge about something, but obviously the best way is a cooperative dialogue, and to talk to your physician in a way that you're working together, obviously, for your best interests. And I think, my experience with the medical profession is that they really care about patients, they really care about people, they really want to help, they're doing everything they can and everything they know to help you, and if you can get on board and speak in a language that's not threatening and ask questions, I think that makes a lot of sense. And even educating your physician with scientific studies, I think, is another good way to go. That's what I try to talk about in my book, that, if your physician's aware that there's a scientific trial that's been done, that's reported in a reputable medical journal, that's been peer-reviewed, meaning this journal is looked at by other physicians who look at the studies and make sure that what's in them is accurate, then I think if you tell your physician about it and educate him about it, I see no reason why they wouldn't want to be on your side and help out. You also brought up, Daniel, the important thing about eating right, breathing right air, exercise, taking care of your emotional health, even your spiritual health. All these things are really important in terms of staying healthy. One of the things that I see commonly is people doing self-destructive things. Smoking, alcoholism, drug taking, overworking, not getting enough sleep, doing things that are in fact harmful. And the real challenge is, how do you change self-destructive behavior to be health-enhancing behavior, to be protective behavior, to be behavior that's going to keep you in balance and keep you healthy?
Such a fascinating world to explore here, but certainly one that people should be taking the time to do. And your book is so extensive, it's one of those we could spend a couple of hours talking about all the different things that you have here in the book. Is there a website people can go and find out more?
Well, I have two websites.
Okay.
One is melborins.com, MELBORINS, and that's the website that's more to do with my speaking, public speaking, the things that I talk about in public. I tend to lecture to groups about laughter is the best medicine, about alternative medicine, about psychotherapy and emotional stuff, about doctor-patient communication, and about stress management. Those are the topics that I tend to speak about. And on the melborens.com website, you have an opportunity to see some of the things that I speak about, and some of the places where I have talked. There's some opportunity to download some of the articles that I've written, and there's an opportunity to order one of my books. I've got An Apple a Day, a holistic health primer, the first book I wrote. Second book is Go Away, Just for the Health of It, about the therapeutic effects of vacations, why holidays and vacations are good for you. And, of course, the Doctor's Guide to Alternative Medicine, what works, what doesn't, and why. And so the melborens.com is a place to order these things. The other website is called Melborens Creative, MELBORINSCREATIV.com. And there is more about this new book. There's some excerpts and chapters from the new book that you could read and get a sense of what's in the book. There's another section of travel writing and articles from different places around the world that I've written about, which are many of them might be in that book, Go Away, Just for the Health of It. And there's also a music component. I've got a number of CDs and one specific DVD, which is 10 inspiring songs that are meant to put you in a very good mood and make you feel more positive about yourself, other people in the world around you. That's called Possibilities, the Pronoia Songbook. And also I've written a bunch of funny medical songs. So if you want to learn about certain topics and you want to do it in a jestful way, I've got a bunch of songs about Pap tests, about colon cancer screening, about mammograms, about kidney stones, about fat in my blood blues, about high cholesterol, and even one about hypothyroidism and kidney stones. So again, that's an opportunity on Melborens Creative to listen to some of the songs and see some of the DVD and also get some excerpts from the book or some of the other stuff that I've written.
Well, I want to thank you for taking the time out of your busy schedule to be here on the program today. Certainly a lively discussion when it comes to alternative medicine and alternative therapies. Find out more by getting a Doctor's Guide to Alternative Medicine. Dr. Melborens, thank you for joining us here on the Beyond 50 radio program.
Thank you, Daniel, for having me. It's been my pleasure.
We want to thank you, the listeners out there, for joining us. You can find out more by visiting us at beyond50radio.com. That is the number 50, and also follow us on Twitter at Beyond50Radio. I'm Daniel Davis. Thank you for tuning in. This is the Beyond 50 radio program, and remember, live your day past halfway.